So I'm going to be talking about how to perform vital signs correctly. There are a few vital signs I want to talk about. So we'll talk about blood pressure, pulse, respirations, and temperature. So for blood pressure, I'll go over the normal ranges. So blood pressure normal range is 120/80. Pulse normal range for adults is 60 to 100 beats per minute. Temperature normal range is 98.6 degrees Fahrenheit, and normal range for respirations is 16 to 20 respirations per minute. So I'll start with blood pressure first. So to take blood pressure, you need two things. You need a sphygmomanometer. I actually have one I can show. It's just the blood pressure cuff. And then you need a stethoscope, which I don't have. I left mine at work. So in order to take blood pressure correctly, you wrap it around the person's arm. Let's see. Usually it'll say where the arrow is supposed to be pointing, so you always want it to be on the pinky side of the arm. So my pinky is right here. Go up, go right here. You'd put the stethoscope right here, hold it there while it's on the arm. You make sure the valve is closed, pump it all the way up to about 160, and then you slowly let air out. And whenever you start hearing the beats, that would be your systolic, and then when you stop hearing the beats, the last one would be your diastolic. So for example, say I started hearing it at, let's see, like 110, and then I stopped hearing it at 60, it would be 110/60. So that's blood pressure. Pulse, you need a watch if you want to do it manually. So you'll have a watch on. You'll grab, say for example, if it's a patient, you'll grab the patient's wrist, thumb side. So blood pressure is pinky side, pulse is thumb side. And you'll put, I like to use my index and my ring finger, put both right here. And say I have a watch, I don't have one right now. You'll watch your watch for 60 seconds and count how many beats you feel. You could also just watch it for 30 seconds and then multiply by 2 with how many beats you get. So for example, if I feel 30 beats in 30 seconds, I'd multiply by 2, it would be 60 beats per minute. Respirations are kind of the same thing. You use a watch, same thing, but you don't use a wrist. So if it was a patient, for example, you would watch their chest rise and fall. So one rise and fall would count as one respiration. So every time they go, that'd be 1. So you do that for a whole minute, just watch their chest rise and fall. And then that'd be, like I said, normal would be 16 to 20 breaths per minute. And then temperature, it's pretty self-explanatory. There's different ways you can take temperature. You could do the forehead one. I know they have like the new ones that you just like click and it just takes it. And then they have the one where you scan your forehead, the temporal, I think it's called. And then they have the one that goes into your tongue, which is I'm pretty sure what everyone uses. And I guess just one thing to say about the one you use in your mouth, just to not drink any beverages before taking your temperature, because it can affect the result. So that's pretty much it. It was pretty quick, but yeah.